And this is the Checkpoints, anchored and co-authored by Elena Kvanchilashvili and myself. I'm Georgi Sakadze. Here we gathered in the Forbes studio to tell you more, as usual, about business and economics.
It is Sunday and 10 p.m. sharp as usual. Pace of vaccination is still the biggest challenge for Georgia. We have counted, and in order to reach Georgia's target, that is 60% of the population 18 years and up vaccinated fully by 2021, as set in the National Vaccination Deployment Plan, daily jabs should exceed 19,000. Today, this indicator stands at around 11,000 on average. This week, the main message coming from the World Health Organization was that by mid-2022, 70% of all countries' population in the world should be fully vaccinated, and that only in this case the world can fight the new strains effectively. Georgia laid a lot of emphasis on COVAX platform to get vaccines in the wake of the pandemic. However, it turned out that WHO was able to deliver much less on vaccine deployment, not only for Georgia, but other countries as well. This and many more aspects came into the interview with the head of WHO Country Office, Dr. Silviu Domente. Mr. Domente, thank you for being with us and taking our questions, and very glad to have finally meet you. How would you assess the current situation, current COVID situation, so to say, in Georgia?
The current situation is worsening not only in Georgia, is worsening in the whole region and globally, because we had like 6 weeks of stabilization, even more, and after that, in the last 4 weeks, we can witness a rise in number of cases of COVID. So the situation, in a way, reflects the similar situation we had a year ago, when the summer holidays started, when the governments have eased all these public health and social measures, and then the touristic season started and so on. So what is important, so it is not unexpected. The WHO has expected this, and the tools we use to, in a way, to shape the situation. So we predicted that in July, August, we can have an increase in numbers, and we warned the member states. And but what is important now is to monitor very closely the situation, and we are again very closely in touch with NCDC, with the Ministry of Health, and monitoring this. The number of new cases in Georgia are stable, but they are quite high, and there is a tendency of increasing, and we know that some of the public health and social measures have been eased.
Was it the right decision? Because we heard from the head of NCDC that it might have been quite a hasty decision to lift restrictions. What is WHO's take on that?
WHO was always promoting a kind of balanced approach, because we understand so, and every country has to take this decision based on the risk assessment and the epidemiological situation assessment at country level. So every country makes these decisions based on that. And we understand there is also overall pandemic fatigue of the population, there is impact of the economy and so on. But at the same time, we have to be careful and protect people's health. And especially taking into consideration that the vaccination coverage is still quite low. So we have to be very careful. But I know that both the ministry and NCDC, they are monitoring the situation very closely, and they don't exclude the reintroduction of some measures in the future if needed.
So would you say that if positivity rate that we have now is maintained, there is, we can foresee another lockdown?
There is a possibility. Nobody can exclude this. Depends on the situation. If the number will go very high, and if the health system will not manage to deal with an increased number of severe cases, then I don't exclude this. But of course, it is the decision of the authorities.
Of course. And you mentioned this pandemic fatigue, and one more component here was that not only to lift the restrictions, but also to forgive the penalties for breaching these restrictions. How does WHO assess this decision?
Penalties are not the best way to improve restrictions. We rely to enforce restrictions, so we rely on population of Georgia. So far in the past, we know that the population of Georgia was quite committed in implementing all those restrictions, and the level of compliance in Georgia was very high because we are conducting regularly behavioral insights surveys on COVID situation, and we know that the level of compliance of the population with measures, with wearing masks, with keeping distance, was very, very high, one of the highest in the region. So it's better to rely on this, on the population willingness, and to communicate this in a proper way to the population instead of just relying on restrictions and fines.
Okay, very, very diplomatic answer, Mr. Domente. Are you happy with the vaccination pace in Georgia?
I don't think anybody is happy, and we know that there are many reasons for this, and the main reason here was the lack of enough vaccines for the country. We know that Georgia was very early prepared for vaccination and for mass vaccination. Georgia developed a very detailed and a very comprehensive vaccine deployment and vaccination plan. So all the structures at central and the regional, local level have been prepared for that, and people train and so on. But unfortunately, the number of vaccines that the country got so far was quite low. But from those vaccines that the country got, so the utilization rate was quite high. We know that from the vaccines that Georgia got, the utilization rate is around 97%, which is quite high. At the same time, so the number of vaccines was limited, and it was not possible to start a real mass vaccination. It's only now recently that Georgia got additional 1 million doses of vaccines. So we expect now the real mass vaccination to start, and we as WHO, we put a target to have at least 10% of the population globally vaccinated by September, 40% by December, and 70% by mid next year. These are global targets, but Georgia went even further. So because Georgia has as a target to vaccinate 60% of the population by the end of the year, of course this is welcomed, and we can only support
What
this.
is your advice on communicating and communication campaign, a proactive communication campaign from the government side, because we haven't seen that so far?
Communication is very important. The reason maybe you say that you didn't see it so far is exactly because the number of vaccines was limited, so it's a bit dangerous to very much promote vaccination when you don't have what to offer. Now these efforts will be increased, and we as WHO, we are working very closely together with the European Union. We have special project on vaccinations, and we are working with NCDC and Ministry of Health. So far already 14 video spots have been produced, a lot of other materials, a lot of trainings prepared for journalists, mass media and so on, and I'm sure these efforts now will be tripled.
I see the slogan, so to say, United Action for Better Health, a very nice slogan. What is your take on how COVAX is handling the distribution of vaccines?
There are many issues related to COVAX, and if you are informed about this, you know that the WHO has promoted COVAX from the very beginning very, very actively, and we still promote because this is the only way, for the time being, it's the only platform, the only channel that can ensure equitable distribution of the vaccines. One of the issues, the situation is like this now globally, and we are witnessing now another wave. Despite the number of vaccines, more than 3.5 billion vaccines have been administered. The situation is not improving exactly because of that, because for the time being, 80% of the vaccines have been administered in 10 countries, the richest countries in the world. So, and in the poorest countries, less than 1%. So this unequal distribution of vaccines is maintaining this pandemic. The pandemic can be ended only if everybody will be protected. Nobody can be safe if anybody is safe.
This is happening despite the fact that COVAX exists.
COVAX exists, and for the time being COVAX distributed a lot of vaccines equitably, exactly following this principle of equitable distributions. But of course the number of vaccines that went through COVAX is much, much lower than those vaccines that have been delivered on bilateral agreements with producers.
When comes the time for the commercialization of vaccines?
For the same reason I just mentioned, it would be very dangerous to commercialize now vaccines, because we need equitable access to vaccines. If we commercialize, again, only rich people will access vaccines, and then the poor people and the vulnerable population will never access those vaccines, or very rarely access those vaccines. And this is the most dangerous, because according to WHO recommendations, we have prioritized groups for vaccinations, and we have to focus on those priority groups, but not on rich people to vaccinate. This will not help.
So you think it was right, the government's decision to be almost fully dependent on COVAX platform in the wake of COVID-19? Because we hear this criticism almost all the time, that government could have negotiated better with suppliers and not be so fully dependent on COVAX platform.
As far as I know, and I was very closely in contact with all responsible persons for this, the government of Georgia started from the very beginning and very early bilateral negotiations, and they were in parallel with the COVAX. So I don't think in this regard the government has lost time, and the government never relied 100% on COVAX. Also, the government supported COVAX, and Georgia was among the first countries in the world who became part of the COVAX. And under the COVAX, Georgia is self-financed country, and Georgia immediately paid for its obligations for the COVAX. Through the COVAX platform, more than 250,000 vaccines have been received so far, but doses have been received, and this will increase. And COVAX actually expects a significant increase in the second half of the year.
We have seen the first contours of 10-year development plan, and its healthcare part. The minister had the presentation. Are you advising on that, Georgia?
Not really on that one, on the 10th plan, but this 10 development plan reflects many other strategic documents that we are developing, because now we are collaborating with the ministry on developing the national health strategy. And this is a big document, again, in partnership with the European Union, and the WHO and other partners, so we're developing this strategy. We worked very closely with the ministry to develop a concrete roadmap for primary healthcare reform in this country. And this is also another very big, important chunk. I already mentioned the new legislation on medicines, which is another very important element. And more recently now we initiated a big collaboration, again, WHO, EU, Ministry of Health and other UN agencies on digital health, and all these are priorities that are reflected in that plan.
Are you generally for increasing the share of state in healthcare? Because we see some steps taken in that direction, right? Like state holdings, I don't know, like increasing budget coverage and so forth. And what is the role of the private sector in the overall system?
Yeah, we know that Georgia is a special case, because here it was massive privatization of the health sector. So no other country in this region has seen such privatization, total privatization of the health sector. And it's not that it's necessarily bad. So both private sector and public sector, they can play a role, and in many countries, so there are different combinations. But this is a unique combination, because you have different types of private involvement, private sector involvement in the health sector, but here most of the private providers, they are all for profit. So in other countries you can have not for profit private involvement, you can have public-private partnerships, And you have different arrangements of public funding for private providers, private funding for public providers, vice versa. So, but here in Georgia, so it's unique because more than 80% of the healthcare providers so are private and for profit. And it's, of course, in some cases, so it creates problems. It creates problems for regulating this sector by the ministry because it's private business, it's for-profit business, so there is no much interference. It can create problems in the crisis situations like with COVID now, and we saw, because you have to mobilize very quickly beds for patients, severe patients with COVID. And then you have to negotiate with those private independent providers and the ministry. When the ministry has public hospitals under its own supervision, so then it's much, much easier. And we saw what the ministry did. First of all, mobilized all those public hospitals and created additional
Yes, but without private sector, it would have been impossible to manage this process.
This is absolutely true, but this was done through very tough negotiations and through paying serious bills. So it was not free of charge that the private sector just created those beds. And we also saw.
Do you think that with the state holding, it would have been free of charge?
Everything costs, of course.
Of course, that's my question.
But this is a problem when you have on the market both public and private providers, so the market gets healthier. So when you have everything monopolized, so it's not healthy. So the ministry created a network of public services at the end. It's a good because people can see alternatives on the market, and it's good. And then there could be a healthy competition between public and private. And then the ministry can also have a better idea on the costs of services for the time being. So the ministry just has to pay the bills that is imposed by private providers. So there are some good things in this, but of course the whole process has to be managed wisely, and these holdings that was created also has to be managed very well and transparently and so on. So,
do you think that the system is and can be sustainable and universal healthcare? If we are very specific here, sustainable without incorporating private sector into it, for example, private insurers?
I don't misunderstand me. I didn't say that private sector has no place. In a country like Georgia, when more than 80% of the providers are private, you cannot avoid not involving private sector. It's important how you involve the private sector, how you regulate the services prices, how you regulate services volume of services, and the quality of services in both public and private sectors.
Is quality healthcare cheap?
Quality healthcare cannot be cheap.
Definitely.
Yes.
My point.
Healthcare generally is not cheap.
Yes.
That's why we promote increased allocations for health, because it is necessary, and at the end it pays back, because there is no economic growth without a healthy population.